Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Hello again, Dr. Moya. How are you?
Hi, Brittany. I am great. Thank you for asking. How are you?
I'm great. Always great.
Okay, good to hear.
So we previously discussed completion procedures at a previous podcast. Something along the lines of it being secondary or extending to other body areas. I'm thinking about the legs, the thighs, and then what's below that is the calf. And you have a procedure that you have pretty much made up yourself, like you always do.
Yes.
Can you tell me more about that?
So I think you're talking about a calf tuck?
I am.
Okay. So yes, at the end of the day, there are some patients who have loose skin of their inner thigh that actually extends onto their lower leg, obviously the calf area.
Mm-hmm.
So for those patients, they may so choose to undergo what I call a calf tuck. What that is really is an extension of the inner thigh tuck, because I haven't found somebody who needs a calf tuck without having their inner thighs done it.
Mm-hmm.
Either it could be done separately or at the same time. So it's just loose skin of the lower leg. And the candidates, who are good candidates for that, those are patients that can actually pinch skin along their inside of their lower leg and pull it away from their body, like we would for a corset or an inner thigh tuck, where you can say, wow, look how much loose skin I have. And if they can pull that skin away from their body and see a difference in their overall lower leg, then they're a good candidate for a calf tuck. I used to place the incision along the back of the calf, actually.
Okay.
I stopped doing that because I found that extending the incision along the inside of the lower leg, like I do the inner thigh tuck, it allows me to actually remove more skin and to taper it better.
Okay.
So tapering is very important when we're doing a calf tuck. So what does that mean? That means that we need to make sure that where we end fits into the rest of the lower leg. So for some patients, that might be halfway down the leg. So for some patients, that might be 3/4 of the way down the lower leg. It all depends on how much that loose skin extends down to the ankle. There are some patients that actually have associated fullness, meaning they still have some trapped fat, subcutaneous fat. And in that case, in order to make that fit, I have to use liposuction. Again, we love liposuction. It's a great technique that we have to make things fit in. So you can't just chop something out and then have like a shark bite, and it doesn't look right. I mean, oh yeah, you don't have any loose skin there, but now your leg looks like somebody took a chunk out of it. No, we never do that. So how do we avoid that? Liposuction. So liposuction will allow us to not only help us remove the skin, but it'll allow me to feather it just right. So when it's done, it looks like a nice smooth lower leg to fit the nice smooth inner thigh. And that makes me happy, it makes my patients happy, and that's why we do that.
Wonderful. Is that a procedure that can be done separate from an inner thigh tuck?
Great question. Absolutely. If somebody had an inner thigh tuck previously, and they say, you know what, I still have loose calf skin, I don't really like that. Sure. What we'll do is we'll design the procedure so that the incision will end into their previous inner thigh tuck incision. For me, most of my inner thigh tucks, if not all of them today, always extend below the knee, because there's always that fullness along the inner knee.
Right. And
so there's a crease right there. It's the top of the calf. So it's perfect for us to go right into that crease and into that up and down incision along the inner thigh from a previous inner thigh tuck. Okay. So it can certainly be done separately. Today, if I do see it, I kind of talk to patients and counsel them, you do have loose skin here. Is that okay with you? Does that bother you? Do you want to do something at the same time? And of course we factor everything in from what they want as an end result and, what fits their budget too.
Right. Okay. So. Wonderful. Well, thank you very much.
All right. Well, thank you.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the Corset Body Lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.